Hello, my name is Peter Lawrence, and I'm happy to introduce the February issue of the Journal of Vascular Surgery, and to highlight 4 outstanding papers which are freely available for the next 2 months. The first paper, the editor's choice for this issue, is called Migration and Sac Expansion as Modes of Midterm Therapeutic Failure After Endovascular Aneurysm Sealing. 295 cases at a single center, by Stenson and co-authors, who report on a relatively new concept in treating aortic aneurysms using endovascular aneurysm sealing to fill the aneurysm sac. The authors used the Nellick device in a variety of situations, including infrarenal, pararenal, and suprarenal aneurysms, occasionally with chimneys for proximal renal or mesenteric vessels. There was a 33% failure rate due to migration, endoleaks, and sac expansion, with some sac expansion progressing to rupture, and many of the adverse events occurred more than 2 years after implantation. The authors concluded that adoption of this or any other new disruptive technology should be undertaken very cautiously to avoid unanticipated late failures, as occurred with this device, which has now been withdrawn from clinical use by the company. Readers may earn extra CME credit for our next highlighted article entitled Carotid Endarterectomy for Asymptomatic Carotid Stenosis is Safe in Octogenarians. Glausman and co-authors from George Washington University Hospital addressed the debate about whether asymptomatic carotid stenosis should be treated in octogenarians. They used the NISQIP database to determine differences in outcome after elective CEA in patients less than 80 and over age 80. Octogenarians were more commonly women, non-smokers, and non-diabetics than those who are less than 80 and underwent carotid endarterectomy. Octogenarians had a slightly higher but statistically significant 30-day mortality, and more octogenarians returned to the OR post-procedure for bleeding. Otherwise, the outcomes were similar between those above and below age 80. The authors concluded that age alone should not preclude elective carotid surgery in asymptomatic patients, since outcomes were similar, but the patients over age 80 undergoing elective carotid endarterectomy should be carefully selected. The third article, by Dr. Aridi and co-authors, is entitled The Vascular Quality Initiative 30-Day Stroke and Death Risk Score Calculator After Transfemoral Carotid Artery Stenting. The authors noted that since transfemoral carotid stenting is associated with an increased risk of stroke, which was 4.1% in this study, compared with carotid endarterectomy, they sought to identify factors associated with a higher and lower risk of stroke. Factors associated with a higher risk were age, non-white race, congestive heart failure, coronary artery disease, diabetes, symptomatic status, and contralateral occlusion. Those factors associated with a lower risk were use of statins and dual antiplatelet therapy. These factors were developed into a risk calculator, which is shown on the right side of the visual abstract slide. The final article highlighted this month is Nationwide Trends in Drug-Coated Balloon and Drug-Eluting Stent Utilization in the Femoral Popliteal Arteries, by Mohapatra and colleagues. They addressed the trends in treatment of superficial femoral and popliteal arteries during the period when drug-eluting technologies were introduced for endovascular interventions in peripheral artery disease. They found that balloon angioplasty, stents, and atherectomy had evolved into procedures using drug-eluting balloon angioplasty and drug-eluting stents more frequently. The percentage of atherectomy procedures fell during the same period. Drug-eluting balloons were used more commonly for shorter lesions and early task lesions, that is task A and B, while stents were used for longer lesions, worse task classification, such as C and D, and calcified superficial femoral arteries. Thank you for watching, and have a happy holiday. For more information, please follow us on social media, and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the excellent papers in this month's Journal of Vascular Surgery. Remember that these articles that I just discussed are free to read during the end of March. Thanks for your attention.